It's not easy. I've had conversations outside of work with people who are graphic designers, and there are two very, very distinct camps. One is absolute terror and a big push away from it. I'm not touching it. I'll have nothing to do with it. It's my creative everything. And the other camp, which is I use it a lot. And I use it as part of my creative process. And I can work with more clients, do more, and kind of move more. It's a very big divide. And we have this within our workforce as well.
Hello and welcome to The Connection, where RLDatix's Chief Customer Officer Liz Jones and Medical Director Darren Kilroy are joined by leaders and colleagues from within the healthcare industry. In The Connection, we explore how people and technology in healthcare can come together to create great experiences and support patient safety. We hope you enjoy listening.
Welcome to the Connection podcast. My name's Liz Jones. I'm Chief Customer Officer at RLDatix.
Hi, Darren Kilroy here, Medical Director at RLDatix, Day 2 NHS ConfedExpo, and we're really pleased to be joined today by Jason Saridis, who is a customer of the company and you'll see the podcast we're about to do with Jason. But as we were about to start the podcast interview with Jason today, we were joined by sheer chance by Lord Victor Adebowale, who is the chair of NHS Confed. And so what you're about to see now is a couple of different things. We have an interview with Victor, the four of us here, and then Victor has to leave us and do other things. And then the three of us carry on the conversation, myself, Liz and Jason, and we hope you find it enjoyable.
Technology, the actual transactional stuff can be put into technological platforms. However, I think the NHS is a bit behind the curve on some of that stuff. I was talking to somebody who worked for Tommy Hilfiger, and one of the things they have is they don't have a rota system. What they have is an app, and basically they people put in when they want to work, and the rota is always filled. So there's always somebody who wants to work, and they've worked out once you get above a certain number of staff, it's always filled. There's always somebody who wants to work Sunday evening or Sunday night, 2:00 in the morning, filled. And if it isn't, then you can manage it. But 9 times out of 10, it works, right? And we don't run. I was quite surprised to find out how little we do that in the NHS. It's like giving people back control.
Is it that self-rostering in a way?
It's self-rostering, but some people have done that. Have you guys done it?
So absolutely, yes. So we support lots of different organisations in the South East.
Yeah.
And one of the trusts, Royal Surrey, is doing exactly that. So they have ED consultants. Rostering.
Yeah.
And although scary at first from these clinicians, it's a fear to put new ways of work.
It is.
However, it was very, very quick that they
soon realised
conclusion of
because
I have control.
Yeah, because one of the impacts of where we are now is moral harm, and one of the cures of moral harm is greater control to the front line. One of the most fundamental controls is control over time. The higher up you go in an organisation, the more control you've got over time. But, and this is the thing I wanted to say, is any digital platform has to be aligned with the values of the organisation.
Yeah.
Which is easier said than done, because you can have some really strange effects that haven't been considered. There's some of the digital recruitment platforms, for instance, I'm concerned that they are inadvertently prejudicial against older people, black people, people who. So there has to be a kind of an alignment, because
How do you think you overcome that then, Alex? What do you think the steps are to make that to get around that?
I think the sorts of conversations. So anybody can walk into a shop or buy a platform off the internet or whatever. But in healthcare, there has to be a conversation between the client and the provider, such that the client knows that what they're buying actually does enhance the values, strategy, operations, plan of healthcare generally, but in that particular trust. Otherwise, the chief exec stands up, talks about anti-racism or whatever, alignment, empowering the front line. Then they get an app that basically is a bit like an Uber app, like, sorry Uber, be wonderful, but you get something that goes, well, sorry, 5 o'clock in the morning, you're up, you've got to do this, that, and the other. It's disempowering, it's discriminatory, and from that point on, whatever the chief exec says, they're going to go, well,
I do always think, if you step back and you say, would I want my job to be like that?
that's the key question.
And I do think that that's so important because at the end of the day, it doesn't matter what the software is. It's software and it's got a set of rules. That's all it is, really. Yeah. What do you want it to feel like?
I always ask them, would I want to do that job? And more to the point, would I want my kids to do it? And if the answer to that is no, it's probably not right.
And
probably not right.
And we've got to be in our bonnet because while being really realistic, I'm not suggesting we become sort of like toxically positive or something about, it's not going to help, is it? Right. But at the same time, I really want kids in school, my friends' kids, I haven't got my own kids, my friends' kids to go, I want to work in the health and social care sector. I think that, and that is that goes right to the heart of what you've just said, which is these have got to be great jobs.
I don't know about what you're finding, but what I'm finding is Gen Z expect certain things, and they expect to have A, they expect to be listened to, and B, they expect to have control. Right?
They need a platform to go forward. So
they do.
Equally, what you were saying about how do we ensure that we recruit and we onboard and we retain a workforce that is fit for the job, regardless of any other factors, and talking about recruitment systems, not supporting some of these things and driving some of the ageism elements. I mean, there's a fundamental shift the NHS needs to move.
I totally agree.
Away from the classical, here's a job.
It's not going to work.
Shortlisting, long listing.
People want roles, they want conversations, and actually, the more senior you go up, I think the more that's important. I think we've got to manage a whole bunch of people better, but actually give them the opportunity to manage themselves. I've got to go.
So, tell us more. What's going on?
Introduce myself a little bit. So, I run a portfolio of work that's now kind of come under the umbrella of something called the People Collective. And ostensibly, it's a transformation program and support program for multiple organisations in the southeast, and started in kind of Surrey areas. And it's looking at how do we take and reimagine the entirety of HR, the incredibly administration-heavy function that exists now, and transform it into what we want it to become, which is a people service, and drive that people interaction. And that journey that we need to take through utilising digital tools in different ways than we've necessarily done before. And that's everything from actually utilising stuff that we bought, some stuff that we spend money, tangible time and effort on, all the way through to connecting things together, using automation to replace the tasks that actually all of these team members within HR finds tedious and boring. Because when we talk to people, it comes to...
I love that, by the way. I love that, Jason, because we don't say it often enough, do we? About the tasks that are they're just hard work. Sorry, I interrupted you.
Yeah, it's like literally copying something from one app to another, and you're using the number pad on that keyboard, and you look at people's desks, right? And you see their number pads have no numbers left on them because they do it so much. And when we talk to these people and we say, why did you join the NHS? Why did you pick this job? Why do you want to do this? And they describe what they actually went for, the job description that was at the front. And it bears no resemblance to the job they do every single day. Now, maybe once a week, once a month, they might get to do those value add elements of their job. But the majority of the time, they're doing administration. Now, this is not just this is not from our ground up positions that we bring people into our HR teams. It's right the way to the top. It's chief people officers even doing these sort of really mundane tasks. And something that's been interesting just with kind of the push of the AI revolution, as it's called, is some of these chief people officers even starting to dip their toes into very simple large language model. Well, I still call it simple. OpenAI would kill me if they heard me say it was a simple large language model, but using it in a really simple way, supporting writing papers, supporting thought processes, and being able to give better, more articulate options as part of directions forwards. And we've also been supporting in that and trying to drive some of those things, because the analytics that we can drive out of some of these things are absolutely endless.
Yeah.
Question on that then. So how do you manage people's people's fears? Because we've talked a lot. We had a session earlier on about AI and human and artificial intelligence coming together. And there can be fear, can't there, in people about their roles. And we're wanting to make them more exciting and rewarding. But of course, what you hear a lot is, I'm just worried that I'll be managed out of being required, because, maybe for some people that will be the case. But so how do you negotiate the expectations of people when they come across your work, and how do you get them on board and engaged with it being a thing that's good for them and a force for good?
It's not easy. Everyone is an absolute individual with the position that they sit in this. So I've had conversations outside of work with people who are graphic designers, right? And there are two very, very distinct camps. One is absolute terror and a big push away from it. I'm not touching it. I'll have nothing to do with it. It's my creative everything. And the other camp, which is I use it a lot. And I use it as part of my creative process. And I can work with more clients, do more, and kind of move more. And it's a very big divide. And we have this within our workforce as well. So we have an entire program devoted to literally doing this human factors, digital enablement and future piece to try and support some of that.
You've got something really fascinating though happening there, because you've got that happening in parallel. So you've got that as a human resources evolving into a people function. You yourselves are having to go through simultaneous change at the same time, where the people that your service look after are going through that because their jobs may be changing on, in terms of clinical roles or others. So it's kind of interesting because, historically you'd have been able to do your bit and then you'd have been able to get this out into the rest of the workforce. So that itself's interesting. So how are you having those dialogues? Is it focus groups? I mean, how do you actually have a conversation with the workforce and the people?
So something we came to a conclusion really early on is it's not just one thing. So one methodology, one route is just not going to support everybody. So it's everything from doing focus groups to doing learning sessions to doing seminar stuff to doing workshopping and kind of pulling people in. And they happen at different levels as well. So you do it large and small audiences, very tight task and finish groups, look at very specific problems and take people on that journey. Now, all of this fear is stuff that we've seen before. Now there's more of it and it's more open now. But we see this with introducing applications 10, 15, 20 years ago. It was the same fear. And when we look at history, and I think back, introduction of computers into the NHS, the absolute fear of computers as they were introduced. And these things didn't have mice at that time, right? As a black and green screen. And the fear and terror there was going to take everybody's job at that point. And then the kind of next step of that evolution and the introduction of more tools, of the internet and everything else like that. And I know the common standpoint at the moment is this beginning of this AI push is a change the likes that we've not yet seen before. But it's the same fears that we're dealing with individuals. And so how we're combating some of this is where we're upskilling people. We're making sure that they have the skills for the future, right? We're not just saying, this is what's happening. This developer is now going to take and they're going to automate this process that you do. Would you kindly tell them everything so that you don't do it anymore? And everything that sits on that side. And what we're doing is we're talking to these people and we're involving them in part of that process, but we're also involving them in what the future is going to look like and how we can get them to that future. Now, some of the challenge that we have is people don't want that future. And a not uncommon conversation is, well, Jason, I am 2 years away from retiring. I don't want to learn something new. I simply don't have it in me anymore.
And you've got to have empathy.
Yeah, you sure have. Yeah, I've dealt with situations in my NHS career with senior clinicians who have that very conversation with you, not about this topic, but it's in general, and we have to respect that position and work with it. How do you approach that situation then when you come across colleagues who say that to you? What's the response you give them?
So there's different people come to different points of this. We often find that that's the first reaction. That is the fear manifesting itself in some logical form. And they want to ground something that's logical. And I suppose part of this is how do we teach the interaction? How do we teach people what that future is? How do we upskill people? And a lot of people think, I'm going to need to go and do formal courses. I'm going to have all this horrid learning. Or they're going to think, well, I'm going to be taught again how I was taught when I joined the NHS, which is day 1, do your statutory mandatory training. Day 2, good luck. In you go. Go for it. Enjoy. And that fear of being exposed to this, for them, incredibly scary worlds with nothing, with no tools, is what drives a lot of that fear. So when we take that away, when we teach properly, we actually help, support, coach, a lot of that comes away. A lot of it is removed.
Changing tack a tiny bit, because you're talking here about actually what's a huge lift in terms of the either re-education or upskilling of, I don't know where we rank now. Are we the 7th biggest workforce in the world? It always changes. At one point it was the 4th.
Everywhere between
it's somewhere, depends on who bought who at some point. But anyway, a huge workforce. And I know there's been a lot of conversation happening, certainly within NHS England, and some really interesting and I think really valid provocations that suggest that companies like ours are partners. We're fortunate enough to be partners of the service, and so where should vendors be picking up the slack to help with this transformation and the training? And, and again, you work with us and hopefully we're a good partner from a system level. But, what more should vendors be doing, not just us, but all vendors, to support you in this?
I think so. There will be 2 schools of thought on this. From my side, it's about being able to enable tools, materials and kind of support. But I think what a lot of trusts ask for, a lot of organizations drive for is, well, can you do it for us? Can you do the whole thing? Can you do that? And the challenge that you have with sometimes is that you then introduce additional fear. You introduce additional boundaries. I'm a firm believer of a lot of these sort of things, we should do within ourselves. And we should drive that change internally within organizations. Now, we were talking a little bit earlier about some of the things about essentially how do we introduce, fair recruitment process? How do we introduce fair rostering practices? And kind of what do we need to do to move some of that? And there's an unavoidable thing around culture, an organizational culture here, that is inextricably part of that change and how we manage that change. And so in one organization that we'll go and support, the resistance to change, the resistance to upskilling, the resistance to all of those sort of things, the resistance to external organizations from them, partners coming in and supporting, is incredibly different within a 15-mile radius.
And this is the point that Victor was making about what the systems, but by that I mean technology, need to be aligned with the values and vision of the organisations, is so crucial, because you and I know that, and we were talking about self-rostering, weren't we? There are organisations who are like, absolutely not, we're not going to enable that for whatever reason, and it may be really valid reasons. And whilst there are others that are really embracing it, and I guess that's it. It goes back to what does a day at work? What do you want a day at work to feel like?
Yeah.
For whichever professional group or whichever team.
Absolutely. Yeah.
What I found is that organisations within the NHS, their values, their core values, and their vision and their mission, nearly every organisation is pretty much the same. it's ostensibly it's amazing, but I mean it looks for all intents and purposes right now that they've taken one and they've smashed it into ChatGPT and said, just make this different enough and do it 400 times, please.
It's amazing how many times you can do something similar for 400 times.
I mean, I don't even know, having sweated through many board meetings of sitting down to think about vision and strategy and different ways to describe the same things that you always do, I always used to struggle with the notion of why every different pocket of trust around the country was sweating over a different strap line to describe what we're all basically doing as a collective endeavour, And the amount of time we frankly wasted on that was crazy.
Absolutely. So for me, and introducing all of this change, frankly, the vision, the values don't matter. It sounds really savage, frankly. It's complete. What actually matters is the culture that's driven. And that culture driven from the top all the way down through the organization, because
if the culture's right, you'll enact the values by default, because that's the mission that you're on, because the culture's set.
And this is it, because ultimately the values that are on a website don't necessarily reflect. We don't grade. We don't grade them so that we can see if they're being done well or not. So they are, as you said, words on a page. They mean nothing for some organizations.
And then obviously you're working at scale now across the system. Have you or would you be interested in looking outside of health and social care to other, just again, Victor mentioning, I can't remember what it was, a brand.
Yeah, it was.
Not very good with my brands.
What the brands were
LD, Primark, I don't know. But
it was a well-known
It was a well-known clothing brand. If it's not M&S, I don't understand. But in all seriousness, you were, would you look outside? Do you think that the health service does enough looking outside at what other industries are doing in terms of that shift towards a people service from a HR transactional function?
No. Well, let me put that into two parts. So do we look? Yes. Does the NHS look in general? Not often enough. There's been a fundamental shift, and that first stage of that fundamental shift is actually looking at other NHS trusts, right? And that was a big step for a lot of organisations to move to that, to having that no competition and collaboration step. And that's been a big piece of transformation over the last 5 years, but that's really occurred. Looking outside of that again is a real challenge. Now, NHSE have been really trying to support that over the last couple of years. And we've been able to speak to people like IKEA. So huge workforce over lots of different countries. How do you manage that? How do you manage your digital infrastructure? Being able to have the same software across lots of different countries. And how do you manage all of these different elements and parts of what you've got?
That's brilliant. That's been facilitated for you to go and see how IKEA have.
Absolutely. And so a lot of it was really, really informative. Some of the key challenges that they face are exactly the same as some of our key challenges. One of those being culture. Again, now we keep coming back to this culture piece, but that being culture, and not just from store to store, but from country to country, being a challenge to maintain. The other side that was from the complete other side of it, the big difference that we found was they were one organization, right, with an overarching leadership, with an overarching vision, and being able to trickle that down properly. And the NHS really struggles in a lot of parts, and lots of people feel this way, that because we have so many bespoke individual organisations, it makes that sort of work significantly harder.
Yeah,
and you can entirely see why, can't you? When you look at it in the broad sense, it's the equivalent of having many hundreds of IKEAs all struggling to sell the same IKEA brand, the same furniture to the same population, but not in a coordinated fashion.
Especially now, because of course then, if you were doing that, if you were taking the IKEA analogy, they'd also tweak the logo a tiny bit and put some extra bits. So, you know what I mean? It's all getting like
slightly different message.
Exactly. Am I in a real IKEA or not?
Exactly.
Right?
Absolutely.
So other furniture stores
they
available.
are.
I think this has been really
great.
interesting.
It's been great.
Obviously, one of the things we're trying to do with this podcast is talk about how the technology and humanity have got to kind of like work hand in glove. And I think the work you're doing is it is about achieving that, isn't it?
So I mean, we're doing all this digital stuff where we built these kind of centralized services to support things as well. So we got something called FlexiBank, which is a collaborative bank service that, funnily enough, exists, the RLDatix platform. And also a centralized rostering across multiple organizations to kind of support things that we've dreamed about for a long time. Free movement of staff between organizational boundaries. Minimal administrative burdens on stuff, because single infrastructure of software and delivery. So we're kind of looking at that whole breadth. That how do we transform everything? How do we transform every experience? How do we move from job description recruitment to a skills-based recruitment platform? And how do we transform how we manage our workforce and ensure that we do have the right skill mixes in the right places? How do we do real-time demand and capacity using big data, billions of rows of data, and how do we do that in real time? And these are kind of all the questions that we're going through, and we have a roadmap, and we know and understand we have to answer every single one of these on this journey that we push and drive towards, and do it, as you said, at scale across not 1, 2, 4. We're talking about across 30 organizations, and then replicating it again for every region until we've got all
We've
of
got
the
the
staff.
advantage of having effectively infrastructure, both in terms of the teams that you've built, the tech platforms. You know, you end up with the foundational pieces that then the hard work is the work you've got to do to you and your teams have got to do to deliver it.
Yeah. And I think what would be interesting is coming back next year, Jason, to hear when you've completed the exercise, to hear how it all went.
Literally took the words out of my mouth.
No, seriously, it would be great because it's such
We'd love to
exciting,
revisit.
such exciting stuff, and we need to keep tabs on it through the podcast.
Yeah, love to
see what's going on.
Yeah, love
Yeah,
to. And
been great to talk to
thank
you.
you
It's been great.
so much for spending the time.
Yeah, hope you enjoy the rest of the expo.
It's been really good.
It's been
fantastic.
great. Thank you for your time. Have a lovely day. Cheers.
Catch up soon.
Thank you for joining us on today's episode of The Connection. We hope this episode has provided you with valuable insights on the role that both technology and people play within the healthcare landscape. For more information and resources, visit RLDatix.com. Don't forget to subscribe to The Connection on Apple Podcasts, Spotify, or any other podcast platform you use. Join us next time as we continue to explore how healthcare is impacted by connecting people and technology. On behalf of the RLDatix team, thanks for listening.